So we want to welcome you to the 2017 Best of ASCO at Miami, where we are reviewing all the highlights of the American Society of Clinical Oncology conference that was done at the beginning of summer. My specialty is in malignant hematology, and here today, this afternoon, we will be reviewing one of the highlights of ASCO 2017 in malignant hematology. We're going to be covering topics all the way from indolent non-Hodgkin lymphoma to large B-cell or aggressive B-cell lymphomas, also chronic lymphocytic leukemia, myelodysplastic syndromes, and multiple myeloma. Just to briefly touch upon some of the highlights of ASCO, is malignant hematology is a very fast evolving field where we have very exciting advancements in all the front lines, on leukemias, lymphomas, and myelomas. For instance, in a part of the recaps that we're going to see today in multiple myeloma, we'll be reviewing new therapeutic approaches to newly diagnosed multiple myeloma. Now that proteasome inhibitors and immunomodulatory medications have changed the natural history of multiple myeloma patients, now we're seeing also the involvement of monoclonal antibodies, such as the anti-CD38 monoclonal antibody daratumumab, which was included on the already well-known and used triplet combination of lenalidomide, dexamethasone, and bortezomib, and showed very impressive results. Also very exciting, we're going to see developments both in diffuse large B-cell lymphoma and also in multiple myeloma about the very famous gene therapy that is causing a lot of comment and toxin among the public, that is called chimeric antigen receptor T-cell or CAR T-cells, that are revolutionary treatments for very hard diseases, including relapse and refractory multiple myeloma and relapse and refractory B-cell lymphomas. For instance, there was a trial that was presented at ASCO that showed very impressive overall response rates in multiple myeloma with CAR T-cells. And also, it was also reviewed data from the already well-known trials of CAR T-cells in diffuse large B-cell lymphoma and other aggressive high-grade lymphomas. In the realm of CLL, we're going to also review longer follow-ups of the well-known clinical trials with ibrutinib, that is the Bruton tyrosine kinase inhibitor that still shows very impressive control rates of the disease with a very acceptable toxicity profile. Also, in the realm of the acute leukemias, we're also going to review new approaches to therapy, including treatments with new FLT3 inhibitors that will be discussed in details today by our distinguished faculty that will be talking this afternoon.